Welcome to Knife Skills, the surgical perspective on health and life. Today you're joining with me on the first episode of my series Journal Clubs, where we look at how to analyze the evidence in the medical and surgical literature. I'm proud to say that we're part of an exciting time in human history where there is a democratization of health information. Patients are more informed than ever about their health choices, and they come to the doctor's office hoping for an opportunity to have an informed discussion. But for both patients and doctors alike, it's important to understand that there are different qualities of evidence. And today we're going to talk about the hierarchy of evidence. The fact is that some studies deserve more attention and more weight by the very nature of their design as compared to other studies. I'm going to put some references in the description below. These are some resources that you can use to further take a look at this concept of hierarchy of evidence. So let's start with the bottom of the hierarchy. This is the lowest quality of evidence, the base of the pyramid, so to speak. Evidence that deserves a quick look but may not make an important decision in your life or in the doctor's treatment plans. And those are case studies or case series. What constitutes case studies and case series are situations where a physician encounters a clinical problem, they try a treatment that maybe they're unfamiliar with or they have not used to treat this condition before, and they see a result that excites them and encourages them. Those will be published in the medical literature as a case study. When the doctor has several examples of these patients, those then become a case series. And those are the weakest quality of evidence because there's no randomization, there's no control, there's no comparator. But it is important to note these effects, and they can generate ideas for future research. The next layer in this research hierarchy is the case control studies. So what these are, these tend to be retrospective studies where we're looking at the actual cases and we're comparing them to similar people in age, gender, ethnicity, location, but do not have the disease. And we look to see, is there an important difference between the patients who have the disease and the patients who don't? And I can think of a good example historically in medicine that a case control study had some important value. And a good example of this would be smoking. At one point in time, doctors started to notice that among patients with lung cancer, there was a higher rate of smoking. They had a control group, people without lung cancer, and much fewer of those had a smoking exposure. This was not causal or definitive, but the signal was very strong, and it started to cause doctors to question whether smoking was a healthy habit. And we all know now how important it is to avoid smoking in our lifestyle. The next layer on the pyramid is something known as cohort studies. Now in this case, we're taking a look at the exposure at an earlier point in time and seeing what the results are. So the groups in this study are formed by their exposure. So an example of this, again, we can use smoking. If you have a group of patients who don't smoke and a group of patients who do smoke and follow them forward in time over many years, that would constitute a cohort study. One of the cohorts has a smoking exposure and the other cohort does not. And we can see a difference potentially in the diseases among these two groups. One of the best known cohort studies in the literature is the Framingham study. And this came out of Framingham, Massachusetts. It's a heart study. And we learned much about blood pressure, cholesterol levels, smoking once again as a risk factor for heart disease, because we were able to follow people from Framingham forward in time and see a difference in the diseases when patients had these different parameters. And then that leads me to the next level of evidence, the first experimental form of evidence in medicine, known as the randomized control trial. Now, this type of experimental evidence may or may not have randomization, may or may not have blinded controls, but it's important to understand that the gold standard, the best form of experimental study in medicine is what's known as the double-blind randomized controlled trial. Essentially what this means is the patients don't know what treatment they're getting. The doctors or providers who are assessing the outcome of the treatment, whether there's an improvement or not, are unaware of what treatment they're receiving. And the patients have an equal opportunity to be in a treatment group or the placebo or control group. And that's known as a randomized control trial, or more specifically, the double-blinded randomized controlled trial. Above that in the hierarchy, though, is an interesting group, and those are called systematic reviews and meta-analyses. And what these are situations where researchers look at the whole body of literature, look at thousands of patients, and combine them together into one research portfolio, one research study, and using techniques such as meta-analysis to bring those patients together to see if there is a treatment effect. Because people who are doing systematic reviews are looking at the entire body of literature, are combining all available studies into this research, it's thought to be potentially superior to randomized controlled trials, certainly superior to an individual randomized controlled trial. However, we'll discuss later on in this series why a meta-analysis may or may not actually be superior to a high-quality randomized controlled trial. So to end off, when you're evaluating a study, you need to consider where that study falls on the research hierarchy. Is it a low-level evidence study, such as a case series or a case study? Is it higher, such as a case control study or a cohort study? Or is it a randomized study, a study that's scientifically experimental? Or is it a systematic review with a meta-analysis component? Start there when analyzing your study, and that will help inform you as to whether this research is worthwhile in making your own health decisions or presenting them to your doctor. My name is Dr. Richard Hillsden. You're watching Knife Skills. Knife Skills is because health is life and it belongs to everybody. Thank you.